thank you all for joining us. I know that we are we're getting ready to kick off this training, and I'm so excited to see so many of you joining us. And as folks come online, these are this is a boards and commissions members ambassador training. And so let me just go ahead and say hello to all of you, and hello, Swanee. We're so excited that you're joining us today. I know that for all of you as board and commission members for the County of Santa Clara, that there are a lot of folks who really rely on you, who think you're, you know, who take what you say as important and as community leaders. And today you're really showing your interest in not just helping with the board or commission that you serve on, but also even more broadly, being able to participate as helping us help the community with their health. For those of you I haven't met, my name is Cindy Chavez. I am a member of the Board of Supervisors in Santa Clara County. And as one of my roles is as past president of the Board of Supervisors, was to start a program called our Ambassador Program. And this program was really intended to make sure that we could get trusted leaders like you the information you needed to explain to the public what was happening relative to COVID-19. And so today, as part of this workshop and training, you're going to learn about 4 major topics: COVID-19, COVID-19 testing, COVID vaccinations, and COVID-19 communications. And that last piece is really critical because we want to make sure that you have the information you need so that when people ask you questions, you're able to respond, and or you can help us get information out to the public. So we're going to really want to make sure that you have the information you need to be the voice of the county and to make sure you can share information. I want to also just acknowledge that we have Megan Doyle here, and Megan Doyle is the clerk of the board, and she's somebody that the Board of Supervisors, and I know all of your boards and commissions, really rely on the clerk's office, and they have been amazing in terms of really supporting our boards and commissions, and they made today's training possible. So if I could just ask Megan, if you don't mind turning on your camera and saying hello to everyone, I would really appreciate it.
Yes, well, thank you, Cindy. And I just, you know, when Cindy approached us with the idea of reaching out to boards and commissioners, it was sort of like, why didn't we do this sooner? So I'm just really happy that all of you are here. And there's that old adage of like, if you want something done, you ask a busy person. And, you know, so we are asking you all who all already have such a commitment to the county and to the community and to the people that you represent and work with on your boards and commissions. Like Cindy said, I mean, really as a trusted leaders. So I'm excited to have this synergy because again, all of you do already have credibility in the community as based on the fact that you serve on the boards and commissions. And so the fact that we can now, that you've expressed interest in helping us be a COVID ambassador to the community to continue to get out the work, and at this really critical time where we're really at this moment where case rates are declining, but we need to continue the path and ramp up vaccinations and really get everyone in the community behind it. I just think this is a wonderful opportunity, and I am so thankful for all of your service. And as always, I just want to reiterate that the Office of the Clerk of the Board and my deputy clerks, all of whom you all know different deputy clerks, we're all here also to support you. So if something comes up and you need something, reach out to that clerk and we'll make sure we get the right answer and get back to you too. So thank you all for being here on a Saturday, and just again, for all you do to help this county and our community.
Thank you, Miss Megan. Totally appreciate you and all of the good work you're doing. And thanks for your continued leadership, Megan. Now, my staff is going to put up a poll, and we're going to see if folks can join in. If I could ask Alex, here we go. So we're going to ask if you wouldn't mind just filling out this poll, and And the panelists, you can't vote, but the folks who've joined us today, you absolutely can. And we're asking how you heard about the training, and what is your best social media? What do you like to use in terms of social media? And how would you characterize your current understanding of COVID information? We'll take a similar poll at the end, but we're you know, really interested in better learning from all of you. The you know, what got you here today and how much you know, because we want to learn a little bit more about whether or not this training is helpful to you. So so I'm just going to ask Alex, are people able to access the poll?
Yes, Supervisor, 20 people so far have responded and more are coming in.
Great, and we have 31 of you. So Alex, when we get close, just let me know. And while you're filling that out, I'm just going to say again, thank you very much for being a board or a commission member. We really appreciate the leadership you've exercised. And Alex, let's figure out what we got.
We're now at 28, Supervisor. It's 90%.
Well, now okay. So let me just see if there's any last. We'll give everybody a couple last seconds to fill it out. Tell me when we hit 30.
Still at 28, Supervisor.
All right. Well, let's
29.
go ahead. What's that?
29.
All right.
Oh, 30. 30.
All right. Let's see the results. All right. So how'd you hear about the training? Coworkers, boss, friend, family, email. All right. The majority of you heard it from email, and then there's some others. And what's your most used social media? All right. Facebook, Instagram, Twitter. Okay. We're going to have to WeChat. All right. And then we've got some others. And then, well, how would you characterize your understanding of a COVID-19? Basic, intermediate, and we've got some advanced. That's excellent. And we'll take a look and see how we do at the end. And then, so let me just talk about what the program is. It's pretty simple. You all are community leaders. You all have access to your social media. And what we want to do is we want to train you to be able to respond to questions, help people in your community get access to resources, and ask for your assistance in getting information out. And so what we're asking folks to do is we're asking you as community leaders to join us and to use your social media and the platforms and materials we make available and get that out to the community. At the end of this program, at the end of this training, we'll send out an interest form, and you can either click the link and fill out a Google form or reply via email with your responses. A link to a sign up for the weekly outreach toolkit will come to you, and links to our social media pages. And one of the things that that I'm going to really encourage you to do is right away sign up for our Facebook page. And the reason for that is there's a particular CAP Facebook page that gets updated information every day that you can grab on and put into your social media. But we're really interested in your thinking. Now, just you'll get invitations to future trainings. We've done them on behavioral health resources. You'll get invitations to some very specific future program updates and future updates as we learn about them with COVID-19. And then one other thing I'll just say is our goal was to get to 1,000 ambassadors. And Alex, what are we at right now?
You're at 500.
So we have 500 ambassadors, and we need your help getting more family and friends to sign on. And we have a group of ambassadors that are primarily Spanish speaking and a group that are Vietnamese speaking. So if you have another language that you would also like to be part of those groups, just let us know as you fill out your forms, and we will find the very, very best way to engage you. Now, just on the ambassador program itself, not on COVID-19, because we're going to dive into that in a minute, but just on the program itself, does anybody have any questions? And if you do, you can put them in the chat, or you can raise your hand and we will get your questions answered. Swani? If our folks can unmute Swani.
Yes, 1 second, Supervisor. Swani, I'll be sending you an unmute invitation. If you could, there you go.
There, can you hear me now?
Yes, Swani.
Yes.
Well, greetings from a very sunny Morgan Hill. The questions that I'm getting, and I live in a retirement community, once a person gets both of their vaccine shots, can they still transmit COVID to others?
So Swanee, we're going to jump into content in just a moment, and that's a great question. And I'm gonna have our doctors respond to that when we go to the next section. Okay?
That's perfect. Thank you. I'll be here.
You bet. And Ava asked a question, where do we see the forms you're talking about? And we'll be emailing those forms out to everybody who participates today. And we can also, if the staff can, we can put those links in the chat as well. Good question though. Any other questions just about the program itself? No? Okay. What I'm going to do then is I'm going to get right over to the the main event here, and that's our wonderful smart doctors. And Dr. Smith, who is the county's chief executive officer, a medical doctor, and also a lawyer, he's a little overachiever here. He is going to kick us off with a COVID-19 101 presentation. And between each of the topics that I talked about, we're going to have a brief Q&A, and then we'll go to the next topic. We're also recording this, so if and you'll be able to grab it later if you want to learn more, or if you didn't hear everything you wanted to hear, or sometimes for me, I take notes in these, so I sometimes need to listen to them again. So with that, I'm going to introduce Dr. Smith, and I'm going to have Dr. Smith kick us off with COVID 101. Then we're going to go to, after COVID 101, we're going to go to testing and vaccines, and Dr. Cortez and Dr. Smith will be helping us with those as well. All right, Dr. Smith.
Thank you, Supervisor. I hope that people can see my screen at this point. Is that true?
Yes, we can, Dr. Smith.
Okay. Well, thank you for inviting me, and thanks everyone for being here. It's very much a pleasure to have a direct conversation with all of our commissions and committee members, because this is a crisis that we all need to be addressing, and we all have to be on the same page of the playbook. So I was asked to just give an introduction, and probably a lot of what I'm going to say people have heard before, but just to make sure that we're starting from the same framework. So this is putting COVID in context with history. COVID is a disease that's caused by a particular virus called a SARS virus. It's a coronavirus, and it's causing a worldwide pandemic. It was first identified in China back in November of 2019. The first death actually in the United States happened here in our county in February of 20. And worldwide, it's caused 2.5 million deaths and 116 million cases. And on the right-hand side is a diagram of major pandemics that have occurred in the world since the turn of the century, last century. And you can see that the flu virus has been very predominant in these pandemics, different types of flu viruses. But the one virus pandemic that we're talking about a lot that's very similar to COVID in terms of its pattern of attack is the Spanish
Dr.
flu.
Smith, Dr. Smith,
Yes.
could you lean in a little closer to your mic?
I'm sorry.
Oh, better. That's much better. Thanks a bunch.
Better?
Yep.
Okay. So we've been comparing it a lot to the Spanish flu because the Spanish flu happened when there was no herd immunity in the world, and the virus spread like wildfire. And you can see COVID started when there was no herd immunity to COVID, and it's been spreading like wildfire. It's a very serious infection. This gives you some context. US fatalities in World War II, over 4 years, we lost 291,000 Americans. Over just 13 months, COVID's killed 520, basically 519,000 Americans. Very deadly disease. As I mentioned earlier, Spanish flu was an example of a pandemic that happened with a community that didn't have any herd immunity. And this is the pattern of deaths. Remember, this is with no immunity. You can see there's a first spike, and the first spike at the far left is what happens to those who are most susceptible to the virus, the elderly. In the flu situation, it was also children. With COVID, it has not been children, but the first spike is the most susceptible. The virus then builds up in the community because those who are less susceptible pass it on. And then once it gets to a critical mass, there's a huge um, kill, as they say. Many of the population die because of the infection. That obviously decreases the amount of virus around because the virus's goal is to infect as many people and mutate and multiply as much as possible, but it doesn't want to kill everybody because then it kills itself. But what happens is there's a large death spike, and then the virus builds up again, and then after it's mutated, another third spike. So that's what we're worried about. And if you look at the county's death pattern, I'm sorry to be talking about death, but that's probably the best way to measure the progress. You can see we had a first spike sometime in March and May. Then it built up for a while, and then we had a huge spike just in January. We're beginning to come down after that spike. But as we've seen in the newspaper, lots of variants have been identified. And there's quite a bit of concern that the third spike is not too far away. The third spike will be with other variants, not the same initial variant. And you can see, if you look at cases, you can see the same type of pattern. The spike that happens a little bit later in July, and then another spike in January. And we're seeing a downturn now, but remember, that's a tricky downturn. The virus changes itself so that it can continue. If you look at our case counts right now, you can see on this slide, all of this is obviously online at our website, but you can see in the far left upper area, the number of people identified with cases is really in the younger population. These are people that are not as susceptible to actually having severe outcomes or death, but they are the spreaders. You can see on the bottom left, there is a representation of the sources of transmission. The important thing to know here is at the bottom column, 58.1%, you can see that there's no identified contact. That means that the virus is spreading without being identified. And that means it's a stealth virus. And then on the far right, we have the effects based on race and ethnicity. And you can see the Latinx population, and you would also see the African American population are disproportionately affected. Our African American population is small in this county, so the numbers are small, but the Latinx population has large numbers. This is a representation of the state's blueprint. You've heard a lot about this. This is the state's reopening model, which has a lot of problems associated with it, but you can see we were recently, the dotted line is the raw number for the positivity rate. The dark line is the adjusted number, and we get adjusted downward because we do lots of testing. So you can see we're recently in the purple and just now moved this week into the red. And because the state keeps changing the goalposts and moving them closer, looks like we're going to be approaching orange fairly soon, which seems to people to be reassuring, but is very scary because the fact of the matter is the virus is building. So these are the kinds of symptoms. I'll just go quickly through this because Dr. Solario Cortez is going to talk a lot about this later. And as I mentioned, we're going into the red tier, which means basically the state has opened up a lot of activities, but the more important thing to remember is just because it's allowed does not mean it's safe. What is safe is to wear masks, and you can see that a N95 mask is the most safe. Double masking is safer than single masking, but any mask is effective. So make sure that you mask. Distancing is important and ventilation is important. You can see here a picture of risky behavior is no masking. The virus spreads through the air, and so it means that people around you are at great risk. Whereas safer behavior is wearing a mask outdoors or with lots of ventilation and staying distant. So with that, I think you have questions that you wanted to share.
Yeah, thanks. I'm gonna, Dr. Smith, I'm gonna just read one of the questions, and then if anybody wants to ask their questions, they can raise their hands. One question is the graph of age distribution seems counterintuitive when the youngest being the highest, whereas I thought it was the oldest who were. Please show that again and explain it a little more if you can. And yeah, Dr. Smith, and as you look for that, the other question is double masking necessary if you have an N95 mask?
Good questions. The slide that I'll show you that I'll go back to was the slide about cases. And I hope you can see it again.
Yeah, if you can make it full screen, Jeff.
Full screen. Okay.
Great, thank you.
So this is cases that are identified, but it's not deaths. If I showed you the death slide, it would be exactly the opposite. So the virus infects a lot of younger people at higher rates, and they typically recover or are asymptomatic. But when it affects older people, they get very ill and they die from it. So that's the difference between the cases and the deaths. And if you'd like, Supervisor, I can go to the website and pull up that slide if you want.
I think for now that's good, and we'll dive back in as we go further through the presentation. And then is double masking necessary with an N95? And then I want to make sure we answer Swani's question. Once a person's vaccinated, I know we're going to talk about vaccines, but just once a person's vaccinated with both shots, can that person still transmit COVID?
Okay, the question about double masking, you really don't need to double mask with an N95. As a matter of fact, it's not recommended because the N95 is fitted around your mouth and nose in such a way that it prevents air from leaking throughout the sides of the mask, and you actually breathe air through the filtered mask. The double masking should be done with either one of the surgical masks, which is the blue type of mask, or two cloth masks, or one of each. And then a single mask is less effective, but still effective. So don't think that, you know, it's inadequate if you have a single mask. It's still important.
Thank you. And then once a person is vaccinated with both shots, can that person still transmit COVID?
I think I should leave that to Dr. Solario Cortez, who's more of the medical expert than me.
Okay, Dr. Cortez, could you mind answering that real quick? And then we'll go on to the next section.
Yeah, that's a very excellent, it's an excellent question. I think it's one of the most common questions I get at the vaccination site in Gilroy. So the science right now, or the studies, don't tell us if you're able to prevent asymptomatic transmission when you're vaccinated. So basically what the studies are saying, or the science is saying, is that it prevents symptomatic disease, what the studies and science right now says is that we don't know if, for example, that particular patient you're talking about, they've been vaccinated with those 2 vaccines, they go out and they don't social distance, they don't follow the rules that we're recommending, they're going to be protected against severe or any kind of disease. However, if that they touch that, for example, I bring the elderly because usually the grandmas they're asking me, can I go go with grandson now? No, because you could go touch grandson. You're not masked, or he or she or they could infect you. Meaning your grandson, you'll be protected, and then you could carry that virus around. You're protected, but and then you go and meet your daughter or son at another household. You might infect that son or daughter because they're not infected. I mean, and that's what I think at this point, CDC and us, we're saying we still need a mask for that reason, because we don't know if you'll be infecting other people by carrying the virus. Yes, you'll be protected, but we don't know if you're going to infect that unvaccinated individual.
Thank you, doctor. All right. So with that, we're going to go just talk about testing now. I think that's, Dr. Smith, do you mind diving in a little bit on testing? And then we'll go to, just so everybody knows, we're going to go to testing, then vaccines, and then we'll talk about community outreach.
Okay, thank you, Supervisor. I hope you can still hear me.
Yes.
Okay. So I'm going to talk just a little bit about testing in our county. And so the question fundamentally is, why is testing so important? And particularly people say, well, gee, we have vaccine now, what does it really matter? Well, it's really the only way we can tell how the virus is behaving in our community. And as we mentioned, there's variants of the virus. So these are different type or same type of virus with slightly different genetics. So they are transmitted differently. They have different infectious capability. And without knowing that and knowing how much virus there is in the community, we can't really come up with strategies to prevent the spread. And unlike a lot of diseases, particularly the flu, 40% or so of people who are infected with COVID might not have any symptoms whatsoever. It's a stealth virus, so they can spread it to a lot of people, and nobody even knows that the virus is there. So testing is very important. So there are some people that obviously must get tested, and that's people who have got symptoms, people who have been in contact with others who have confirmed cases of COVID, frontline workers who have lots of contact with the community, but also anyone who feels that they're at risk or has not been wearing a face mask or for some other reason feels that they are at risk should get tested. And anybody who wants to get tested can be tested. So in order to get tested, we mentioned that there are some people that the health officer has specifically addressed who should get tested. We're not going to obviously enforce it in the sense of, citing people for not getting tested, but you should know that you have a right to be tested, whether you're getting tested at one of the county sites or at your own provider site, Kaiser, PAMP, your private doctor, whatever. And again, if you've had symptoms, been exposed, referred for testing, or you're an essential worker. And in our county, the best way to get an appointment to be tested is to go to sccfreetest.org. That'll tell you where there are testing sites around where you live or where you work, and you can make an appointment at those testing sites. And one of the big sites that we have that is operated by the county is open 7 days a week, and here's, you can see the schedule. This is the county fairgrounds site, and it's near Gate B, near the Blue Arch. So it's a walk up, drive up, or bike access site available. And for other county operated sites, you can go to the SCC freetest.org, and it will tell you where you can get sites, and it has all the information about scheduling an appointment, where the sites are, which city they're in, what the test is like, and how you do it. Now, one of the bad trends that we've been seeing lately is shown here. The blue columns are the number of tests that are being done. The red line is the positivity rate. Our positivity rate is going down, as I showed you in our last session, and that's great. That's good. But the thing that's bad is that the number of tests per day is also going down. We have the capacity to do twice as much of as many tests as we are doing. And by decreasing the number of tests that are actually done because people don't sign up, and they don't show up, that means we're having an effective sampling of the community that's much smaller. So even though the positivity rate goes down, if you're only testing a smaller group of people, you can't be quite as sure that you're getting a good picture of what's actually going on with the virus spread in the community. So this argues that we're doing a good job with testing, but it would be better if more people came in to get tested. And then here is a positivity rate by census tract in our county. You can go online and get a lot more detail. You can go down to each individual census tract, click on the census tract. It'll tell you how many people live there, how many people have been tested, what the positivity rate is by census tract. But in the big picture, you can see that positivity rate, the darker colors, greater than 7% are in the East San Jose area and South County area. These are areas that we're very concerned about. If we put up the death slide also, you would see the same picture. That's where the disease is most deadly and causes the most harm. And there are multiple reasons for this, which I won't go into in detail, but obviously everybody is quite aware that these areas are very densely populated, so the spread of the virus is easier in dense populations. And it's important to look at the number of the positivity rate. You can see in some areas of the county, it's around 3%. In the very hard hit areas, it's a little bit over 7%. The effect is basically about double, not quite, but about double, a little bit more than double. So it's very important that we realize that nobody is safe unless everybody's safe. So if you happen to live in one of the lower positivity rate areas, that doesn't mean you're protected or you're safe. It means that you still have to maintain distance, wear a mask, avoid indoors as much as possible. But more importantly than even that is we have to make sure that the individuals who live in the high risk areas are safe too. So that's that presentation.
Thanks, Dr. Smith. And I want to make sure that we get a chance to answer questions. If you have written questions in the chat, then I'll read them. And if you want to raise your hand, we'll do that too. A question for Dr. Smith. Are you suggesting that communities should be doing more testing even while asymptomatic? Is there a guideline somewhere?
The guidelines are, as I pointed out, only required if you've been exposed or you have symptoms or you're in a high-risk environment or high-risk work. But the test is free for anybody. And yes, I would suggest that people set up a pattern for themselves based on their concern about their exposure, maybe once a month, once every 2 weeks for people who are in high risk environments, once a week for people who have jobs where they are constantly in contact with other individuals. Remembering that just one negative test doesn't mean you're negative forever. It means you're negative that particular day, and you can get infected the next day.
And then another person asked, I got one shot without going for testing. Is there a problem with that?
No, if you have access to a vaccine, Dr. Solario Cortez will talk about vaccine in a bit. But if you have access, you should get the vaccine. You don't have to have a test before you get the vaccine.
Thank you. And then one a question, this is back on the masking. I thought they said N95 with vent doesn't protect others. So I thought that a person wearing an N95, and I think with the vent on it, still could infect others, though they're protected. Is that correct? And that's why I've been wearing a cloth mask over an N95.
Well, that's a great question. And there are different types of N95 masks. Some of them do have vents. They are N95 masks that are designed for construction work to prevent the wearer from getting inhaled small particles. But when the wearer exhales, their entire volume of air goes out through the vents. So you're right, if you're wearing that type of mask, it's less protective of others. It's protective of you, but less protective of others. The N95 that you're supposed to be wearing is the one that's a medical mask that doesn't have a vent. But if you have to wear an N95 that has a vent covering it up on the outside is a good idea. So the N95 at your skin with a cloth mask over the N95 that has a vent.
Thank you. And Dr. Smith, what is the difference between a K95 and a KN95? And is one more protective than the other?
The K95 is the construction design, which is the one that typically has the vents. And, I just talked about that. The KN95 is typically the medical one that doesn't have vents.
Thank you. And then
maybe Dr. Cortez wants to add something.
Oh, go ahead, Dr. Cortez. Sorry.
Yeah, sorry. I don't have anything to add on that one. Sorry.
Okay.
Oh, okay.
And then should you still double mask after being vaccinated? And then the other question is, should you test after being vaccinated?
You should definitely double mask at all times, as Dr. Cortez pointed out. Just because you're protected doesn't mean necessarily that you can't transmit the disease to other people. So masking is important, whether you're vaccinated or not. In terms of getting tested after you're vaccinated, I'll leave that with Dr. Cortez. I think the answer is it's not necessary, but go ahead.
Dr.
Yeah,
Cortez.
I would say it's a case by case basis. I mean, for example, let's say we have a person that has become, got the vaccines, Moderna, they're both vaccines, but let's say a month later, they're presenting with classic symptoms of COVID. Then in that situation, I would say, yeah, we should test you, because I'll mention these in my slides, the vaccines are very effective, at the 95%, but there is that 5% that's not effective. So I mean, there's still that chance that you could still become infected. So, and just to like err on the side of caution, in that situation, which I'm the hypothetical situation that I'm mentioning, I would test that individual. Even at, I'm a physician at Valley Medical, and for us, we're being tested like every 2 weeks, and we're still going to continue. And I guess what the gist of what I'm trying to say is that vaccines are getting us to normalcy. And it's it's the light at the end of the tunnel, and that's what we hope that we get to, and there's no third wave. And for that reason, I think our systems, county, US, we're still going to be at the side of caution, meaning that even for healthcare professionals who have been vaccinated with a 95% effective Pfizer vaccine, you still want to and then also what one of the ambassadors mentioned is can you transmit asymptomatically, and that's the reason why we at work are still going to be tested every 2 weeks, and it's for that being safe, for that extra 5% where we're still a little bit unknown.
Thank you. And then I'm just going to say to all of everybody presenting, if we could lean into where we think our mics are. I actually don't know where mine is. You did great, Doctor. But Dr. Smith, I think we have lost a few of your words. One other question on masking. How often is it necessary to wash reusable cloth masks? I wash after every use, and does that reduce the strength of the filters? These are the filter pocket masks.
You don't need to wash the filter part of the pocket. You should exchange it with another clean filter on a regular basis, and that all depends on how much exposure you have, how many people you're around, how much risk there is. I don't think there's a standard answer. If you're just wearing a cloth mask without a filter, that should be washed on a regular basis. Also, again, no particular number, but once a week at least, maybe once a day if you are around a lot of people. I hope that answers the question.
Thank you. And so Dr. Smith, you gave a very thorough answer on the KN95 and N95, but your voice was getting lower. And the KN95, that type of mask is a construction mask, right?
Right.
And that type of mask often has the vents. The N95 is a medical grade mask, and that often does not have a vent. And so the difference is that, one's for construction, one's not. I just want to add that the double masking with cloth is better than not masking. And I want to say that because I think that, for a while we were worried that there wouldn't be enough of these other masks for either construction workers or medical doctors. We were really encouraging people to double up with the cloth mask. But anyway, I hope that answers Lavella's question. Okay, so I don't see any other questions on this. So we're going to go to Vaccines 101, and Dr. Cortez is going to take us away.
Good afternoon, everyone. Again, thank you for inviting me today, Supervisor Chavez and Dr. Smith. And thank you all, ambassadors, for being here today. My name is Gerardo Solorio Cortez. I am a physician in internal medicine at Valley Health Center, Gilroy. I'm a primary care doctor there, and I also, I'm working at the vaccination site at the Gilroy High School. So a little bit of background, what are viruses? So viruses are small germs that need people or living things, animals, to multiply. And they make you make you sick until your body fights it off. Or in some cases, as we've seen, the viruses does hurt or kill the individual. The common cold is caused by a virus as well, as is the flu, measles, and chickenpox. COVID-19 is caused by a virus as well. And in particular, it is known as the SARS-CoV-2 CoV-2 virus. So when a patient becomes infected with the virus initially, it can take several days or weeks for the body to fight the infection with their immune system, including their B cells and T lymphocytes. So the patient fights off the infection, and if there's a second case of COVID-19 that wants to infect the patient in the future, that patient will know or will have their machinery ready to fight that infection again. This is what usually happens in other viruses. However, in COVID-19, it's a novel virus. So what we're seeing is that, and the recommendations are from the CDC, that a patient that becomes infected with COVID-19, they're very unlikely to become infected again with COVID-19 in the first 90 days. But after 90 days, especially now with variants, it's possible that the patient is not protected with this immune system. And hence, we recommend that individuals get their COVID-19 vaccine, even though they've been infecting themselves with the infection. Next slide, please. Next slide.
Doctor, you're muted.
Go back to what kind of viruses cause COVID-19. I apologize. So coronaviruses are named for their crown-like protein spikes on their surface. As you can see in the cartoon there, you have a sphere, and on top of it, you have spikes, hence the name coronavirus. We've actually experienced coronaviruses in our lifetime. The cold, the simple cold is caused by the coronavirus. It is the one that's causing us trouble, of course, is the SARS-CoV-2 virus, which is in the same family of coronavirus. And none of us had immunity to this particular type of coronavirus. Next slide, please. So what are vaccines? Vaccines are made in the laboratory and tested in animals that includes mice, chimpanzees, and then they move into doing human trials with individuals. Once inside the body, the vaccines teach the body's defense system to be able to quickly recognize the real infection and have the defenses, antibodies to quickly fight it before it can make you sick. So basically what we're doing is we're giving you something to prepare your own body to make the cells that are going to fight when the real intruder gets into your body. Next slide, please. How were vaccines developed? And as you've seen, it's a novel virus, and with that comes a novel way of thinking and doing things at the local, state, and national level. And you probably heard the term warp speed, which was started in the past administration. So that was started, and basically the government asked scientists, pharma, private industry to develop and manufacture, and actually, let me step back, actually come up with the science to develop the vaccines. The county does not develop, test, or approve or manufacture any of the vaccines. This is all more at a higher level, national level. Vaccines were tested with thousands of individuals across the United States, world, that encompass different ages, races, and ethnicities. Basically, these studies looked at individuals who were vaccinated and not vaccinated. The vaccines were reviewed by the federal government and state authorities, and they're ensured to be safe and effective. Next slide. As mentioned, the development of the COVID-19 vaccine was very fast and safe. Multiple companies, networks worked together to get this done quickly. An important point is that manufacturing was started while the clinical trials were being conducted. Normally, manufacturing starts after the clinical trials are done, but in this case, being an emergency situation with the COVID-19 pandemic, again, going back to warp speed and scientists and federal government, the decision was made to do things in tandem. And importantly, with the vaccines that came out, being the Moderna and Pfizer, that technology is mRNA, and it's the swiftness of making these type of vaccines that enabled us to make a quick and fast vaccine. The FDA and CDC reviewed, authorized, and recommended the approval for the said vaccines. None of the usual steps in vaccine approval were skipped. And that's, I think, even though things move very, very fast, scientists in these board meetings and the whole pipeline had checks and balances to ensure that there was safety and effectiveness. Next slide. So what kind of vaccines are available at this moment right now? So we got the Pfizer, Moderna, and Johnson & Johnson. The Pfizer and Moderna use the mRNA technology and require 2 doses. The Moderna is given 28 days apart, and Pfizer is given 21 days apart. The Johnson & Johnson is only 1 vaccine. Next slide. This is a good slide showing the technology, as I mentioned, mRNAs for the Moderna and Pfizer. And for the Johnson & Johnson, the technology that we use there is conventional viral vector. In a gist, pretty much that type of science is using another virus that's dead, that's not going to cause you any illness, but using it to input part of the information that will make the spike protein for that individual. So the Johnson & Johnson technology is different. But as you can see in the middle of the graph, which is very, very important, I think that'll be one of the takeaways that I want you all to take, is that they're super effective. I mean, look at the Moderna, Pfizer, they're at 94, 95% at preventing COVID-19 illness after the second dose. And for the Johnson & Johnson, you're talking about 74% effectiveness at preventing moderate to severe disease and 86% at preventing severe disease at 4 weeks after. And then lastly, what I actually tell all the persons that come in for vaccines is that all these 3 vaccines, if you were to ask me, if I have an individual that has no vaccine versus one of these vaccines, the individual that gets one of these vaccines is going to be 100% protected from ending up dead or in the ICU. And that's I think that's a very, very, very key point. And then the last 2 rows, you'll see just the common side effects. And actually, let me step back. A common term that we're using in conveying the reaction to vaccines is reactogenicity, which basically means the normal immune response to a vaccine to an individual. And it's pretty much, it's telling you, so the pain on your shoulder or the fever or the headaches is pretty much telling you, the patient, that your vaccine is working. It's not to say that if you don't get it, it's not working. It's still working. But the point is that we want to use terminology that it's truth, meaning that it's just a reaction to a vaccine, but also it eases the patients. Next slide, please. So this slide is going to be a little bit redundant of what I said, but pretty much it's, if you look at the cartoon, is we have the spherical cartoon, and then you have spikes on top of it. So these vaccines use the technology to make part of that spike, which in turn make your body make those antibodies. They kind of look, they have wings. That's your antibodies that were made because your vaccine worked. Next slide, please. I've talked about, Moderna, Pfizer, and J&J being already approved. There's 2 other ones that I know of, like AstraZeneca and Novavax that are also in the pipeline. So by adding these vaccines, it will add to the available vaccines so that we're able to reach our herd immunity, which you probably seen in the news with Dr. Fauci and CDC saying that we want a 70% herd immunity, and the only way we're going to reach that is by we don't want to reach that by letting innate immunity, meaning that people become sick. We want to do it by using our vaccines, and by having more, we'll reach that goal. Next slide, please. This is a very important slide because, as we mentioned in the previous discussions here, is the testing and also still being vigilant to looking out for the symptoms of COVID, because it takes time for these shots to work. Meaning that if a patient comes in today for a vaccine and for X reason tomorrow they're exposed to a COVID-19 patient, the vaccine hasn't had time to build up their immune system. So that patient is very susceptible to if they didn't have the vaccine. So you still use the same protocol. I mean, I will still use the same protocol and say, well, if that individual who got the COVID vaccine a day ago, but now they're having symptoms, I'm still going to treat them as a potential COVID, being affected with COVID, and I will test them. So again, it takes time to get the immune system to work. The studies say that usually to get to the like 70% effectiveness of each vaccine, Moderna and Pfizer, it takes 4 weeks. To get to the 95% effectiveness, it'll take 4 weeks after your second dose. So as mentioned, it's very important to continue the social distancing and masking. Next slide, please. So again, as mentioned, get vaccinated. The Pfizer vaccine is approved for individuals of the age of 16 and above. Moderna and J&J is approved for people with 18 years old and above. Next slide, please. I mentioned the side effects, which include sore arm, redness, mild headache, and maybe some chills, fevers. Again, the studies say that these symptoms happen more after the second dose of Moderna or Pfizer. Of course, with J&J, since it's only one vaccine, it'll happen after, if it does happen, it'll be after your first dose. And not to worry, studies say that at most you'll get these side effects at 2 days maximum. Next slide. Frequently asked questions. It's maybe a redundant slide, but as I mentioned, very effective vaccines. Pfizer 95, Moderna 94. Do I need to be vaccinated if I've already had COVID-19? And I kind of alluded to that on one of my initial slides. So this is what we know. So COVID-19, a patient becomes infected. It's very unlikely that you'll be infected again in the next 90 days. But at 90 days, for sure, all our bets are off, and it's the CDC recommends that, yeah, you should be vaccinated because there are variants. Now, if I have an individual within that 90 days that wants to get vaccinated, they can too as well. As long as they're out of the 10-day quarantine period, they can as well. Studies right now say that it's okay to give, that there's no issues with your innate response that you had, within that 90-day window with the vaccine that we're going to give you. One caveat that I would say is that if you got COVID and you got a IV treatment, the monoclonal antibody called bamlanivimab, which is what we give to certain individuals that are higher risk for bad disease, we'll recommend it and we'll give it as an IV dose as an outpatient. And I'm very happy that Valley Medical Center, when the pandemic started, and as soon as this was approved, we gave that vaccine. We gave that treatment. So if anybody gets that IV infusion medication, the monoclonal antibody, they need to wait 90 days no matter what. And I would chime in as well. Very important, this comes across not too often, but frequently, is you cannot be vaccinated with any vaccine in the last 14 days. Let me say it again, because I think it's an important point. So if a patient comes into the vaccine site and says, I got the flu shot yesterday, guess what? Unfortunately, we're gonna have to reschedule your vaccine, and you're gonna have to come back at 14 days later. Why is it? Again, the studies that were done, they were done fast. The study population was that none of the participants had any vaccines within the 14 days. The last question is, how will patients be notified for the second vaccine? Usually at sites with the Valley Medical Center, there's someone there to make your second vaccine. And yes, as mentioned by Dr. Smith and all, is at this moment, we're still you get vaccinated, and please continue to social distance and wear the face mask. Again, until we reach the 70% herd immunity, and we get the blessing of federals and scientists and to take off our masks, then we'll do that. But I don't see that, and Dr. Smith and us is that's months, maybe a year away, but hopeful as well. Next slide, please. So at this moment, who is currently eligible at March 6, 2021? The state decides who can get the vaccine, when and where. I'm sorry about that. When they could get it. Currently, there are healthcare personnel, residents of long-term care facilities, age 65 and above, frontline workers in education, childcare, emergency services, our food and agricultural sector who live and work in the county are eligible to get the vaccine. You can also track the latest news and eligibility on the state website, covid19.ca.gov/vaccines, period. Next slide. And if you look at the latest county information, please go to scfreevax.org. We have information in multi languages, including English, Mandarin, Chinese, Spanish, Vietnamese, and Tagalog as well. Next slide. Here are the website in 5 different languages as well, and the phone number for COVID information, 211, as always. Any vaccine related questions, please call 408-970-2000. Next paragraph. Next slide. Again, if you're eligible to get the vaccine, please contact your healthcare provider, go to the website, or contact your the system you're part of, Kaiser, Santa Clara, PAM, or Stanford. Next slide. Again, thank you for the work that you're doing. Continue to use our social media, Facebook, website, Twitter, or continue to follow it to see the latest information of what the county is doing to combat this disease. Thank you for your attention. If you have any questions, please let me know.
Thank you very much. That was a lot of information, and some of the questions you may have touched on, but I just want to make sure we ask them anyway. I'm looking at okay, so Kathleen King, in-home support services and family care members taking care of disabilities. And Kathleen, I'm going to ask if that's a question or you were responding to someone. Maybe just type it in the chat or
Okay.
oh, go ahead, Kathleen. Is that a question or a comment?
No, it's a comment that those are eligible as well, and sometimes get forgotten. So I just wanted to remind the doctor.
Oh, great. Thank you. Thanks very much. So in-home supportive in-home support services workers are also eligible. Thank you very much. Since there are different variants of the virus, is it possible for a person to be infected yet test negative in the basic test, but at the same time show some symptoms like breathing problems, fatigue? And what should patients do in this situation? And does the county provide antibody testing, free antibody testing?
Yeah, that's a very good, excellent question. I would probably step back and say, let's not get, so if a patient has symptoms of COVID and the initial test is negative, and there is still a high suspicion for COVID, then that patient should be retested. And that's what happens in clinical practice. We had those cases where a patient has been negative and they're positive on the subsequent test. In terms of variants, and I think Dr. Smith might be able to help me. We're not testing variants in all labs that we get from people. We're definitely testing you if you're positive for COVID, but the actual like genetic testing, the actual type is not really at this moment. I don't think it's a encompassing or it's a do it all maneuver or test. It's like I think it's a case by case basis.
Yeah, and Dr. Smith. Yeah, I'll
Mhm.
let Dr. Smith answer that. Thank you. Dr. Smith?
Yes, you're right. We do surveillance genomics, which means that for a percentage of the tests that we do, we send them to a different laboratory to run the genetic measures of the virus. That's what identifies the variant strains. We also are working on a new technique to do variant testing on sewer effluent, which sounds bad, but really helps us with monitoring how much variant there is in the community. We don't test everybody for genomic testing. We use it as a surveillance tool to just see how much of that particular variance is in the community. And I think part of the question was whether you could get infected with two different types of variants sequentially. I think the answer is yes, but the likelihood, if you've been vaccinated, is small.
And then thank you. And the next is there is a lot of ambiguity with new variants mutating. As research predicts, there may be some barrier to preventing you from getting violently sick after the vaccine. But what might transpire once travel resumes globally? Can the variants be the cause of aggravating the transmission? I don't know, Dr. Smith, if you want to respond to that, or Dr. Saladio Cortez.
Either one. I can take it. Basically, there's a lot we don't know about the variants right now. There are a number of different variants. I think the way to think about it is that the virus succeeds in living by changing so that in the future it can infect more people. And so the variants protect it by looking different, from a immunologic perspective. So the proteins change on the spikes a little bit, therefore the antibodies don't recognize it. Right now, we're monitoring worldwide the variants, and as they pop up, they're being analyzed carefully. Some of them seem to be more infectious than others. Some of them cause more significant disease than others, but we really don't have a way of predicting the future. All we know is that more variants are caused by more infections. So the more prevalent the virus is in the community, the more variants are going to be created. And we have great fear that a variant spike will happen in the near future because, as I showed you with the slide related to the Spanish flu, as the virus changes, it develops a whole new population of host people at risk, because even if you've been infected with a previous variant, you have risk of getting infected again with a new variant. Hope that explains it.
Thank you. And I'm going to ask, yeah, thanks. And I'm going to ask folks just to lean in and when you're responding to questions. I think I broke one of my speakers, so it might just be me. Pfizer required extra cold freezers, and later Moderna came out and they modified the standards to be regular freezers. Is this to be competitive, or did studies show that the Pfizer will be effective kept that way? And if so, why did they put so many places through trying to buy or access the special freezers? Dr. Smith, or Dr. Solario, Cortez, do either one of you want to respond to that?
I guess I can try. Can you hear me?
Yeah, we can, Jeff. And
okay.
Yeah, thanks.
The freezing was the way that the vaccine was developed, and basically because they were doing warp speed, trying to get the vaccine out as fast as they possibly could, they didn't do a lot of testing about whether it could be stored in different environments or how long it could be thawed or the like. So I don't think there was any intention to make it more complicated. The intention was to get the vaccine available as fast as possible. And Pfizer knew that if you stored it at -70, it would be protected from degradation. Moderna found it that you didn't need to have it at -70. So I don't think there was any particular intentionality behind it.
Thank you. We have another question. Are members of private healthcare systems, PAMP, Kaiser, required to get the vaccine from the provider and not the county?
The way that the state distributed the vaccine initially, and I got to say that it's in the process of changing, but initially what they did was they distributed vaccine to county public health departments, number one. Number two, to what they called MCEs, or multi-county entities, which were entities like Kaiser and PAMP, where they had an insurance population that crossed different county borders. And then they also distributed some to the pharmacies, commercial pharmacies. And as well, the federal government separately distributed vaccine to pharmacies for nursing home patients and to the VA and other federal agencies. So if you get a vaccine from Kaiser at this point, it's coming from a distribution that went from the state directly to Kaiser. Some of the institutions that are large institutions like Stanford, or all of the small clinics, community clinics, all get their vaccine from the county.
Yeah, and one thing I'll just say, we've got a couple of questions in the chat. Thanks, Jenny. We got a couple of questions in the chat about a little about the key symptoms. And I just want to let folks know that we'll make sure we send out the slides to all of you, because I think we had one slide that actually is really good that you can post on your social media that will tell people a little bit about the symptoms. But if I could ask Dr. Saladio Cortez just to cover the symptoms again, just because I do think that's important to keep educating folks about.
Thank you, Supervisor Chavez. I think that's one of the, it's an excellent question, and as I heard it, a minute ago, I'm pondering, because we started, back in March. It's an upper respiratory infection, so cough, fever, chills, headache, main symptoms. But as it evolved and as how it's progressed, I had patients in my clinic, or just going to the ER with headache, a new unable to smell, unable to taste, chest pain. I had one individual who actually suffered a heart attack, and the thought process was that it was all related to COVID-19, even though that patient had maybe a day of a cough, fever. So the symptoms are, even rashes. People present with rashes, and it's COVID related. So, but I would say that just the gist of it would be the usual upper respiratory infections: cough, fever, chills, nausea, vomiting, diarrhea. Would bring up your antennas that this could be related to COVID-19. Definitely.
Yeah, thanks for that question, and thanks for the response. Some individuals have received their first dose, but the center is shut down. What can that individual do to get a second dose? And I think on this front, Mary Lynn, if you respond back to our email with the particulars of that particular case, we're happy to follow up to make sure they get connected to a second appointment, and also to better understand where they went. And because I don't know that we've had centers that have actually shut down, but if the particulars of that, we're happy to follow up. And I would just say, if you have folks who have particular challenges like that, get those cases to my office and we'll respond as quickly as possible.
Supervisor, can I add to that?
Oh, please, absolutely.
Pam Sutter had a problem that they're just now trying to get resolved, where they had to cancel statewide about 90,000 second doses because they didn't have enough virus. It was all Moderna, and they're rescheduling people for those doses.
Yeah, this was Good Sam.
I'm sorry?
This was at Good Sam, Jeff?
No, it was actually through Pam.
No. The case that they're discussing was a Good Sam patient.
Oh, Good Sam did also have some problem initially.
Yeah, but they're not giving vaccine. But Mary Lynn, get us the person's detail and we'll follow up. Yeah, thanks, Jeff. But that's a good point, that some places have had to cancel, and also because of vaccine availability. Will Planned Parenthood be giving vaccine to their patients? And Dr. Smith, you want to respond to that? Yeah, they will.
Yeah, we supply vaccine to Planned Parenthood. Of course, the major issue here is we don't get enough vaccine from the state to cover everybody that needs to be covered or that's eligible. So yes, we will distribute to the small clinics and to Planned Parenthood, but there are limitations that are being made at the state level.
And then two more: what medicines should be avoided before or after vaccines? And then this is coupled with that. Another question is that another person asks that they understand you should not take painkillers 6 hours before or after vaccine. And would you confirm that?
That's a very excellent question. I mean, stepping back with COVID-19, I remember back in March, April of last year, and I'm talking the actual disease, some scientists were saying that maybe Motrin, Advil was not a good idea because it can make things worse. I don't think that data, panned out as, that it's true. Now, going fast forwarding to, COVID-19 vaccine, I haven't come across any data that says that you shouldn't do a Tylenol, acetaminophen, or a Motrin, ibuprofen for pain. Like, let's say you do have a headache. Can you do a Motrin after? Yes, you can. I think. Yeah, you talk to your provider, make sure that you shouldn't be doing Motrin, Advil for other reasons, or Tylenol for other reasons. But there's no hard evidence that says if you take a Motrin, if you take an Advil, it's going to make your immune response less efficient because you took that pill. No one said that. And before, and also just answering the question, do you take a Motrin, Advil? There's some people are not going to have symptoms, so I think it's a waste of doing the Motrin, Advil before if you don't have any symptoms.
Thank you. How are antibody tests affected by the vaccine?
They're not affected. So I think that's a very excellent point, and I think if I had a more elaborate vaccine presentation, is pretty much I would say that vaccines are not gonna affect the testing of the COVID through your nasal swab or the blood test. If going back to my example of a patient, getting the vaccine today, 2 days from now have symptoms, I test them, or let's make it a week so that we don't confuse the side effects of the COVID. But a week later, that person comes in with symptoms and I test them and their swab comes back positive for COVID-19, it is COVID-19, and it's not the vaccine that caused this COVID. The patient probably got infected in this window period.
Thank you. Does a megadose of vitamin D help alleviate symptoms after the shot? There have been reports that it helps if infected.
Again, bringing up excellent points, and we've seen this even through the since the pandemic started with the actual treatment, the treatment for COVID-19. People have brought up vitamin C and vitamin D. I think certain hospitals, doctors are doing that, even an inpatient. However, there's no hard evidence that there or evidence that says vitamin D super whopping doses is going to prevent or treat COVID or help you with the COVID-19 vaccine.
Thank you very much. And I know both of our doctors have been talking for almost 2 hours, so an hour and a half. So I want to thank them very much. And thank all of you. And you can keep putting questions in the chat or in the Q&A. We're going to go to our last section, and this is really about where we need your help. This is the community outreach piece. I'm going to ask Alex and Jack if they can lead the way on this section. And thanks to both doctors. Let's give them a virtual round of applause.
Thank you.
The crowd goes wild. Thank you for the great presentations. All right, Alex.
Thank you, Supervisor. Please confirm that you all can see this.
Alex, you're going to want, yes, we can, and you're going to want to speak up just a bit.
In fact, let me just get my laptop closer. Okay, can you hear me now?
Yes, perfect.
Great. Okay, so thank you, Supervisor. Hi, everyone. My name is Alex Lynn. I'm part of the CAP team in Supervisor Chavez's office. My colleague, Jack McGovern, and I will give a presentation now on COVID-19 communications. I will begin with top-line messaging, SCCFreeTest.org and SCCFreeVax.org. And then Jack will go over the weekly outreach toolkit and social media. The community is experiencing information overload, including, unfortunately, a lot of misinformation. And all of this is resulting in pandemic fatigue. To combat this, we are providing top-line messages of the week for you to emphasize in your information dissemination and outreach. Oftentimes, these messages will be the same from week to week, but they do change based on what is happening in the community with vaccine administration, case rates, and other factors. Of course, our top-line messages right now are: get vaccinated by going to SCCFreeVax.org. Get tested by going to your healthcare provider or going to SCCFreeTest.org. And I know that you've heard these URLs many, many times today. I assure you it is intentional. And Also, reduce your risk by masking up, staying more than 6 feet apart, and staying home as much as you can. The infographic on the left is one of many available on the County of Santa Clara Public Health Department social media, as well as the CAP social media accounts, which Jack will go over. As you heard today from Dr. Smith and Slorio Cortez, there's a lot of information to disseminate related to vaccines, but here are our top messages: that it is safe, that we will get the shot when it is our time, and that we should not drop our guard. The top questions in the community right now, understandably, are whose turn is it now, and when is it my turn? All members in Phase 1A and Phase 1B are now eligible. The county health system and several other health systems have implemented a no wrong door policy system where we're providing vaccines to all who are eligible regardless of insurance. For up-to-date information on vaccines or to schedule a vaccine appointment, refer people to scc.freevax.org or to 211. As a reminder, vaccine availability and eligibility are changing rapidly. The changes come directly from the states. The county updates scc.freevax.org regularly as new information becomes available. The county has launched a data dashboard with info on vaccine administration to county residents, including the total number of residents vaccinated to date. You can view the information by age group, gender, race and ethnicity, date, or overall. Allow me to pull this over here. So I know this has been gone over already by the doctors. If I could just go over it really quickly again, we really want to cement in how easy it is to use this website. And we feel the more times we show you, only 2 times, but the more times we show you, the more comfortable you'll feel walking your neighbors, your family members through it as well. So if you navigate to scc.freetest.org, it'll take you to this webpage. As Dr. Slorio Cortez and Dr. Smith said, it's in English, Chinese, Spanish, Vietnamese, and Tagalog. Let me make it bigger just in case. And if you click here, schedule an appointment today, it'll take you directly to this website, Fulgent. Excuse me, there's a Zoom tab control panel here. And you can change the language. It's in English, Spanish, Vietnamese, and Chinese. You can make an appointment here to go through the process and hear frequently asked questions. Now back to this page. Here, if you wanted to, let's say, search by city, and let's say you live in Campbell, you go to city, you'd click on Campbell. It would take you directly to here, and it would show you all the testing sites where you can get tested in Campbell. Now, this is scc.freevax.org, and it as well is in Chinese, Spanish, English, Vietnamese, and Tagalog. And if you'd like to book an appointment, you'd click here, and then you'd go through one of these links. And that's this site. And you can see at the very bottom of the page when they were last updated. So this one was March 4th. This one was March 5th. And now I'll hand it over to my colleague, Jack, who will be discussing the weekly outreach toolkits and social media. Jack?
Thanks, Alex. Can everyone hear me? I'm going to take that as a yes. So my name is Jack McGovern. I am one of the CAP team members, as Alex said. I will be walking us through the county support resources, the outreach toolkit, and the community ambassador program social media. So first we'll go over the support resources, which we will ask you to share with your friends and neighbors. So on this slide, you'll see a full list of websites, phone numbers, and emails, which Supervisor Chavez referenced earlier in the training, available to support county residents. So when you go spreading information to your community via email, social media, through the ambassadors program, you'll be able to share with them these resources regarding COVID-19 information, including SCC free test and scc.freevax.com, resources for workers and businesses. So for many of our ambassadors, this section is key because I'm sure you all know some small business owner who's struggling right now. So please send them these numbers and websites. We have support resources for them to help them through this time. We have support services on here as well, including our COVID-19 support team and Second Harvest Food Bank. The support team helps those who need help isolating or quarantining by providing housing, transportation, meals, and more. So we'll be sure to send this out and this presentation out to all of you so you have this information readily available and you can send it to whoever you need. Next slide, please. So now we'll go over the Outreach Toolkit. The Outreach Toolkit is a weekly newsletter emailed out to each of our ambassadors. It's been prepared by the Emergency Operations Center and contains multiple posts regarding the top line messaging for the week. After this call, you'll be sent a link to sign up for the toolkit. Please sign up right away. If you do not receive the toolkit next week, please make sure to check your spam folder and email us at sccap@bos.sccgov.org. Again, we'll send all this information out to you so you have it. And then if we have the Outreach Toolkit on here so you can see what it looks like. There are multiple templates of social media posts for you to share. This week's top line messaging is about risks of getting a vaccine, weekly schedule of vaccines, and Santa Clara County entering into the red tier. So the toolkit has social media posts, templates in Spanish, Vietnamese, and other languages. So anyone can have access to these important information. If you access the toolkit in your web browser, which you can do by clicking view this email in your browser at the top of the email, you'll be able to see past issues of the toolkit and see templates from previous weeks. So we want to keep our messaging simple, to the point, and repeat them as many times as possible. That'll really help augment our societal behavior. So feel free to ask us any questions about the toolkit after this presentation. So next slide, please. Finally, we'll go over the CAP social media pages. So the Santa Clara County Community Ambassadors Program, Facebook, Twitter, Instagram, and YouTube channel are all live. So please, right after this, go like and follow us on all our platforms to stay updated on all things CAP and for easy reposting of information to your personal social media accounts. So I'll go through the sites just to make you familiar with them. So here we have our Facebook page. You can find posts from the Outreach Toolkit, updates on upcoming trainings, and more. Please go like and follow us, share any of our posts, and then do a little post and brag a bit to your friends and families that you're an official CAP ambassador. So if we go to our Twitter page next, please. So here we have the Community Ambassador Twitter page. You'll find updates from the CAP team here, the County Public Health Department, the California State Public Health Department, and other pertinent information related to COVID-19. So you can see here we have old posts. So please go retweet things. If you don't want to have a Twitter, no worries. This is a good resource as well. Next, if we could go to our Instagram page, this is the CAP Instagram page, similar to our Twitter page. We'll post from the County Outreach Toolkit here and include other updates related to the county. So you can see we have posts from the Outreach Toolkit from our Public Health Department. It's a fun way to share pertinent information to your friends and family. And finally, if we could go to our YouTube channel, please. This is where you'll find recordings of past trainings. So this will include ones we've done in Spanish, Vietnamese, and supplemental trainings on behavioral health. So please go rewatch any and all videos, share them to your social media, email them to friends and family. We have all of the past information here from the Community Ambassador Program. So again, we'll send all of these links to you via email after this training, so you'll have them readily available and you can go like and follow and post that you're a community ambassador. With that, we'll pass it back over to Supervisor Chavez to close us out. And if we have any questions, please let us know. Thank you.
Thank you so much. And I will respond to Mary Lynn to your question in just a moment. But overall for this program, I want to make, Swanee, thanks for sending it out. But I want to just say to everyone how much one, we appreciate your participation. And Alex, do you want to either do a full view with everyone, gallery view? That'd be great. Thank you. So, so anyway, I wanted to say thank you all. I know this was a lot of time and we appreciate it. And we're really asking you to sign up today, become part of the solution to, you know, getting the information out. And what we know is that it's really difficult to get to every nook and cranny of the community, but you all are community leaders who can help us get to every nook and cranny. And that's really why we're asking for your help today. And I do just want to say a very special thank you to our team and to Dr. Saladio Cortez and Dr. Smith and to Megan Doyle and her team. And we're going to continue to reach out. So if there are other folks that you have that you think, hey, they really ought to be helpful, they've got followers, we want them. So if you can go to that, to Facebook or whatever is most easiest for you and just sign up right now and let's get this information out, particularly because the next couple weeks, as we're trying to get more vaccine into the community, are going to feel a little rocky. And Alex, I have a request, and that is that Santa Clara, the city of Santa Clara did the most hilarious social media, and I want to put it on our social media, and I want to ask you to post this because I think it's such a great way to tell people to wear their mask without being a bossy Bessie, as my sister sometimes would call me. So on that front, Mary Lynn just asked, what's the impact of Blue Shield in terms of vaccinations and testing signups? You know, to be honest with you, we're really concerned about the partnership with Blue Shield, and we see this as kind of, to be honest, a step back. And the reason for that is our county, under the leadership really of Drs. Smith and our EOC and Dr. Cody and our hospital system, were able to get in partnership with our private sector and nonprofit partners, we got to be able to testing at 25,000 persons a day. We have the ability today, if we had all the vaccines, to test up to 125,000. That's why we're building out the infrastructure. And we're concerned that Blue Shield's involvement has already taken us back. So we're going to work really hard with the state to see if we can't get them to leave Santa Clara County in its current place in partnership with the state, because we think that's the best way to serve all of you. And our highest obligation is to make sure that our community is healthy and safe, and we'll continue to fight for that. So with that, with a very big thank you to all of you, I want you to see this. It's hilarious, and recommend that you post it, and we'll put it on my Twitter page, my Twitter right away. Thanks all.
Hi, I'm Lon Peterson with SCTV. I'm here live in Central Park in the city of Santa Clara as we've received multiple reports of Bigfoot sightings here at the park. Unfortunately, we've been looking around for over an hour with no luck at all. So apparently the legend lives on. Oh my gosh, let's go. Did you see him? Look at this there. What? You've seen it here live first on SCTV, Bigfoot adhering to Santa Clara County's public health guidelines. Follow Bigfoot as we continue to practice social distancing to stop the spread of COVID-19. Visit santaclaraca.gov/coronavirus to find out more about COVID-19, free testing dates, vaccination information, and the city's multiple relief programs. Play it safe and stay healthy, Santa Clara.
Thank you all very, very much for joining us. And a very special thank you to the city of Santa Clara for making that hilarious. And that's the kind of stuff you'll get on our Facebook page. If you, and all of that, you'll sign up, you'll see some great stuff that other cities have done that we're going to keep sharing. Thanks all very, very much. Be safe, be well, wash your hands, don't touch your face, wear your mask, stay 6 feet apart. And then when it's your turn, get vaccinated. Thanks all. Have a good rest of your day. And thanks team, you did great.